Good morning to all our viewers in South Asia, and a very good evening to all of those who have tuned in from the United States of America or other parts of the world. We are here with a very, very important and interesting guest today. If you're on Twitter, you know that there is one doctor, one leading expert who's trying to demystify and simplify what's happening with the COVID pandemic. Every day, at least I start my day by reading what he has to say about the COVID pandemic. He is a doctor who is literally tweeting from the COVID front lines. And I'm welcoming to this live stream on the Mojo Story today, Dr. Faheem Younus. He's the head of the Infectious Diseases Center at the University of Maryland, and really then does know what he's talking about. And what we're here today to talk about are the do's and don'ts. What I really love about his Twitter feed is that he doesn't talk to us in medical jargon. He simplifies it for us, and he tells us practical things that we should be doing and not doing. So over the next 40 to 50 minutes, we are going to take your questions, and Faheem Saab has agreed to keep this bilingual. आप हिंदी में बोलना चाहें, उर्दू में बोलना चाहें, तो बेशक अपने सवाल हिंदी और उर्दू में भी भेज सकते हैं, and Faheem Saab will juggle between all of the three languages. Welcome. Good evening to where you are. It's night time actually, almost 11 p.m. Let me start by asking you, I think what everybody wants to know, Faheem Saab, is the worst behind us? Where do we stand?
Thank you very much for having me. Nobody knows where are we. And that is the problem with this pandemic, because it has spread all over the world. The reality of each country is different. Within a country, the reality of each state is different. That's how complex it has become. If you ask the question in New Zealand, I think the answer is yes. The pandemic is behind them. If you ask in India, I think, and this is all my gestalt, I don't know best, but if you put a gun next to my head and said, pick one, I'd say if this was a cricket match, we're towards the end of the first innings. That's where we are. I don't think we are at the halftime yet.
That's not good news, because, test cricket is a long haul, and you're saying we can't look at this as an IPL or a one-dayer. And we're not anywhere near that.
I meant a one-day match, by the way, not test cricket,
okay.
not that bad.
Okay, not that bad.
Talking somewhere close to the halfway mark, hopefully.
Okay, you've been talking about April 2021 being this kind of crucial watershed moment. You've also been saying that your heart tells you that the worst will be over perhaps by April 2021, but your head tells you that this can drag on till 2022. And I'm saying it like this because I really think the world cannot live like this anymore. There is COVID fatigue. The Economist had this great line that we may be tired of the pandemic, but the pandemic is not yet tired of us, sir.
Yeah. So multiple questions there. Number one, I think the reality is we all want it over. We all want it over now. But we have to look at, I've seen nearly 25,000 patients in my life. And one thing I know, that what patients want to know when they're in the hospital, doc, when will I go home? So I've been trained to give patients a projection as to when you foresee. When I say April 2021, by the way, I never say that it'll be over. I look at that as the goalpost. We will reassess at April 2021. And this is why. Number one, we would have gone through a bad winter or a good winter. We don't know whether the twindemic of influenza and coronavirus, what it will do. And I think it will do different impact in different countries. What happens to India, we will know in April 2021. By that time, hopefully more than one vaccines would have been approved and somewhat tested. So we will know more about the vaccine. By that time, the US elections would have been done. Believe it or not, things have an impact. If one thing this pandemic has taught us is how interconnected we are. The politics, the economy, health, they all go hand in hand. You cannot have one without the other. Those uncertainties, hopefully, of the economy and the global economy would be a little bit more obvious. And then, and then lastly, our treatment protocols would have matured even further. So this is why I keep saying April 2021, because we as human beings can at least go another 6 months. When you say 2 years, that's right. That's where people then get frustrated. So I don't want to give them any broader timelines. But I think all of us, if we work together, we can get to April 2021.
Now, Dr. Faheem, I have lots of questions of my own, but this live stream really is for our viewers who are tuning in from all across the world, and I can already see my stream filling up with questions. So I'm going to take a few questions of the audience first and then ask my own question. We have Arjun here who says, is COVID pneumonia more dangerous than COVID per se? Is there in fact something called COVID pneumonia?
Right. So the answer is it's a spectrum. Some patients with COVID, about 30%, will have no symptom at all. Another 40-50% will have cough, sore throat. And then maybe the last 5-10% will develop a pneumonia, and out of that, maybe 2 or 3% will be in a hospital and 0.5% will die. So it's just a progression of the disease. COVID pneumonia happens in the later stage of the disease.
Okay, there's another question. This is from Musay Abdali, who asks, COVID patients have started getting back to workplaces within 15 days from the date of their infection. How vulnerable are others due to this phenomenon? I think this is a great question because, quarantine periods everywhere the world over are 14 days. Is 14 days a significant time if you've had no other complications to recover and go back to work without endangering other people?
It is. It is, because many of the studies in which we try to, so there are two things here. If you test that person at 15 days, chances are their PCR may still come back positive. But if you put that same virus and try to grow it, it does not grow. So our science tells us that it's dead virus, which is just lingering around, but it is not able to cause disease in others. Now, will there be 1 in a 10 million patients who can transmit? Of course, there's an outlier in every situation. That's what I keep telling people about that. Can an aeroplane crash on my house right now? Yes, it can. But am I worried about it? I'm not. So I think I want people to remain in the realm of probabilities and not look for guarantees. There are no guarantees in life. But yes, 15 days is a safe enough period.
Okay, there's a next question from Pavan Kumar, and I've seen your tweets on this. You're not very convinced about COVID reinfections, and the question is about COVID reinfections. And I do want to add a little bit of my own data on this. I was doing a story on 3 hospitals in Mumbai where doctors say just between 3 hospitals in one city of India, they have found 23 cases of reinfections. Among them was a young resident doctor. And she first tested positive about 3 months ago. And then 3 months later, she tested positive again with different symptoms, completely different symptoms. Now, there's a lot of debate, and I'm sure you're aware of this, about whether this is a reinfection, whether it's a mutation, or whether it's a dead virus that remained dormant. So in this context, Pavan Kumar says, what is the probability of reinfection? Can I still be a carrier if I have been positive in the past and come in contact with someone currently positive?
So number one, there is no carrier state. After 15 days, you're done, virus is dead.
Yeah.
Like HIV or herpes, it integrates into our body. There is a carrier state. For coronavirus, there is no carrier state. So that's number one. Number two, reinfections, once again, see, there are things that are of academic value. I think it's an amazing academic value to us as clinicians. And I believe that conversation belongs into the amphitheaters of academic medical centers where we debate these ideas all the time. I don't like to scare people about it because I think it does happen, no question about it, but it's extremely rare. And the pandemic cannot be crushed if we keep fighting over rare issues. And I use that word carefully because a lot of people fight over these things. The idea here is there is about, let's just pick a number. I would say there is 90% of the facts known about this virus that are enough for us to crush the pandemic. If we all agree on those 90% facts, I think we can get to victory. The other 10% are unknowns. This belongs in that unknown where we know it happens, but we don't know whether it's 1 in a million, 1 in 100, or 1 in a billion. So that is why I always tell people to contextualize it and not worry about it too much. It is possible, but I don't think it's common.
So when you say it's possible and when you say it's in the realm of the academic, do you mean that it is that much an outlier event that we actually should not be wasting energy on it?
I personally believe an average person shouldn't be wasting energy on it. That is correct.
Okay, I think that's useful to know. There are other questions coming. There's somebody very worried with a question about the vaccine. And the question from AV is, when the world has not found a vaccine for AIDS, even now, why are we so sure that we will get one for COVID-19? And I have an added question on this. Will herd immunity come before the vaccine?
Yeah, so comparing HIV with coronavirus is like comparing a spider with a car. They're very different. They're extremely different. And coronavirus is a simple RNA virus. The first coronavirus in 2003, named by SARS, the vaccine SARS was almost ready. We never had to launch it because the virus just burned out itself. We still don't know why and how. Number one. Number two, herd immunity. For most countries, we will not reach herd immunity before the vaccine. The US population-based immunity is probably around 10% right now. We have no good data in many South Asian countries. Remember, even though India has done a lot of tests lately, but I personally believe for all the practical reasons, we were a little late to the game. Compared to US, still there are 6 times less testing done in India. And that's not just India alone. Many of the developing countries or larger countries have different challenges. So my hunch is if you did seropositivity studies in India, that India will not be more than 10 or 15% as a country. Now,
so I want to interject there because
Yes.
there have been actually 3 serosurveys that have been done in 3 major cities, Delhi, Mumbai, and Pune. And actually the results are startling, and I wish there was clearer official communication on this, because the serosurvey tells you that 1 in every 3 people in the city of Delhi, where I am today, are seropositive. 60% nearly of people in Mumbai slums are seropositive, and nearly half of Pune is seropositive. So what that is explaining to us, Dr. Faheem, is the fact that many more people have tested positive, but fewer people are dying from it. The IFR, the infection fatality rate, is much lower. So is this virus not as fatal as we had feared?
Great question, great point. So once again, remember what I said was, if you take India as a whole, I'm aware of those studies, but what if you went to Gurdaspur and you did sero studies? What will be that number? If you went to Agra? By the way, Delhi, when the moment you say Mirza Ghalib's Shahar, so I still bhi Urdu mein sochta hu, English mein bolta hu. So one day I wish I could come to Delhi. It's a beautiful.
I hope you can. I hope you can. But carry on. Yes.
Yeah, but going back to your point, so I personally think herd immunity is anything around 50-ish, 60-ish% for this virus. Again, it's a complex phenomena, depends on many, many different factors. But my hunch once again is, if you looked at every person living in India, that number will be lower. And why that is important? Because this virus is going to continue to find new homes. Once it depletes Pune, you don't want it to go 100 miles away and start all over again, right? It's like fire in the forest. That's number one. Your second question about IFR and what's the fatality rate, I think that's a very good question. And it can be misleading. So let me tell you, that's good news for individuals, bad news for countries. Why? At present, we believe the fatality rate is about 0.5%. It could even be lower in countries like India, Pakistan, where there's younger populations. Yeah. Now, for an individual, that's very good news. If you're under the age of 50 and you don't have diabetes, obesity, cancer, heart disease, all those comorbidities, your chance of survival is very high. I don't say this so you become complacent. No, you should. Sure. You should remain careful. But when you're looking at a country like India, when you're looking at large numbers, 0.5% can be a very large number. Let's look at it this way. God forbid, less than 10% of India, for easy math, 100 million people got the infection. You know what the 0.5% will be? 500,000, right? That's the death toll we're talking about. And don't forget about 3 to 5% hospitalization. Do you have enough hospital capacity for 5 million people? And the other unknown is we still don't know the chronic effects of this disease. There may be some people, again, we don't know how many, some who may not recover in 2 weeks and may take much longer.
So I do have questions on the long COVID phenomenon, but I still want to push you a little bit more on this fatality rate. Now, from data in India, we know that 3,000 people in India die every day from tuberculosis and another 3,000 die from cancer. What nobody has done, and I don't know if these comparative studies have been done in the United States either, has been to tell people that more people are dying from COVID on a daily basis than from other infectious diseases. Can you clear the air on this? Because in India, while the Sero surveys actually tell you that many more people have already got this virus than the official numbers tell us, and that's possibly good news, I'm still holding on to this good news because I'm still hopeful that this means fewer people are dying from this than we initially feared. I get what you're saying about even a small fatality rate is a very big number in a country with a big population. But how does this compare with other diseases, other possibly fatal diseases?
So this is a great question, and there's a reason I've always said we need to stay between the extremes of panic and denial.
Yeah.
We need to stay in the middle. There's a reason it's not happening coincidentally that if you on my Twitter, I don't talk about policy. I don't talk about lockdowns. I don't talk about what governments should do because of the exact same reason. When you understand the complexity of this thing, every government has a very difficult challenge at their hand. Every government. And we should empathize with them. We should not it's very easy to criticize a government, but nobody would want to be in that hot seat today. And that is precisely for the reason you mentioned. What is the mental disease impact? You know, what's happening to our mental health with lockdowns? What's going to happen to the economy? How many people will die of heart disease at home and they'll not go to a hospital because they're afraid? And those studies are published. Actually, the amount of time someone took in Hong Kong to call ambulance went 3 to 4 times during an outbreak because they were afraid. So you're right. I think there are competing factors here. But the reality is this pandemic, when something dominates the news media, it generates anxiety. It takes so much international attention. It just has a truth of its own. And I think the good thing about COVID is we are going to win this within a year, 2 years, 6 months, whatever that time period is. And tuberculosis, unfortunately, will still be around. So this is still a transient thing. If we put aggressive measures around it, I think it'll help the economy move on faster.
But would you say that the data tells you that this is more fatal as a percentage of population than other infectious diseases?
Again, it will vary. It will vary in different parts of the country and different public health infrastructure. And it's very hard to compare one with the other because, as I said, there are just so many variations.
Okay, back to the audience questions. We have Shahran Asim saying, are you sending your kids to school or do we complete online learning till April 2021? This is a hot topic in India. Schools are closed, but exams are taking place. Parliament has opened in India, but several MPs actually tested positive. We've had a minister die this past week, a union minister, federal minister die this past week from COVID. We have Delhi's deputy chief minister in the ICU right now. So this is serious what we're talking about. What would you say on schools?
Yeah, a lot of students have asked me on Twitter about trying to support their cause to cancel exams for GET and whatnot. And I had to Google. I didn't even know what the JEET meant. So I never responded to them. This allows me to apologize to them. I know I didn't respond to your Twitter questions because I don't think I'm competent. These are difficult decisions for your government. I don't like to intervene into internal issues, whether they're any country. I try to minimize that. Your other question about whether I'm sending my children, I follow laws, I follow rules. In my campus, schools are closed right now. So my children are doing online learning. They pretty much hate it. I get it. You're right. At the same time, if the percent positivity in your town is less than 5% and there's a good infrastructure to test and treat, I think it's okay if you ask me. The children are resilient, their outcomes are much, much better. And that's where when you compare this disease, and I hate that comparison in general, but particularly for children, if you compare it with influenza, the outcomes are sort of, not that bad. So I would say follow local policies and realize the other impact on children. Now, again, it gets complex. The child will not develop symptoms, but he brings it home and grandma catches it from the child. I understand that's where it gets complex, and that's why I try to stay out of it and let local governments make that decision. It's a very different.
But, while not asking you to comment on any country or any government's decision, how long can we live like this? I think to me that question comes up again and again. Is it not better to find new precautions to take and get on with the business of living, get on with the business of education? Because literally, if we are not in a better position by, let's take the watershed that you've defined, April 2021, children can't remain out of school forever. There is a digital divide in our part of the world. In India, only 11% of households have access to computing devices, right? We have parents struggling to pay fees. Children have been locked out of online classes. So I'm just saying, not to endanger anybody's life, but if this is our world and we have to live in it, is it not better to talk about what we can do to get back with the business of living while taking precautions, Dr. Faheem?
I've always talked about it, that public health allows us to live on. It is not there to imprison us. And that is why if we wash our hands, if we wear a mask, and to whatever degree possible, if we avoid crowds and do social distancing, I'm a big proponent that life must move on. And I've made an example of this thing with driving. You don't let your 10-year-old, give them a key to the car. And if we didn't go through driving lessons, imagine the chaos on the roads. But what do? We first go to driving school, we learn the rules of driving, we make sure we are not sleepy or under drugs, we put a car seat belt on, and then even on the road, we follow rules. What do? We have social distancing, right?
Yeah.
We have distancing in the car. So it's the same sort of behavioral pattern that we have to learn as communities. And yes, life should continue with precautions. I've never advocated for big shutdowns.
Great. That is good to know. There is more questions coming in. This is Parth Mukherjee has a question. When do I know that I do not have a normal flu and I may have COVID? The symptoms are similar. So when should I get tested?
Yeah, unfortunately, I don't know who can distinguish between the two. As I said, I've been an infectious disease doctor for over 20 years and I cannot. So unfortunately, the right answer here is either you isolate yourself for 10 days or you get tested for both influenza and COVID. One thing, and I don't know what kind of information will be available in India, but if you have seropositivity, if there is a general idea if flu is now endemic and it's coming out, then you start thinking of flu, because flu is a very seasonal disease. Your positivity for flu may be very low. I think flu typically hits January, February. So this would be early for flu, but that's where the government can help by giving you numbers at what time flu is now common in the community. And then you should start thinking about it. That may be a good guide before we start over testing everyone.
Okay, now to the simplest thing that we know can work, masks. How much of how much of optimism, let's say, should be derived from the wearing of masks? And there are many questions related to masks. So let me first ask you, are masks really the game changers that they're made out to be?
Exactly, yes. And I would say by this, what do you think Taiwan has? Do you think Taiwan has a better treatment or a vaccine? How did Taiwan control the disease? And I can name 15 countries, right? The important thing for us to remember is there are countries out there that are living normal lives, that have full stadiums and having sports going on. How did they do that? By test, trace, and isolate. So masks help. Imagine if you have droplets coming out of your face. Every time we talk, we sing, we cry, we laugh. There are micro droplets that we emit. If I'm wearing a mask, you are protected from that droplets. So the biggest advantage of a mask is it protects people around us. But when we do it all as a community, then my mask protects you and your mask protects me and essentially kills the virus.
But there are questions related to this, right? When you go for a walk, and in India, public spaces are now, because people are fed up of sitting inside, and as we unlock, people are going out for a walk, they're going out for a run. In Mumbai, we had a very tragic story of somebody who was jogging, who was running with his mask on, and he died, right? When I walk, because I walk in an open space and there's not someone immediately close to me, I have to say I do not wear my mask because I feel claustrophobic. Should you be wearing a mask while walking or running? Nobody has clarity on this.
Yeah, so, and I know some people will be unhappy no matter what I say on this, but I'm going to tell you what I think the science says.
Yeah.
If you're out there walking, running, I don't think you need to wear a mask because your encounters are such fleeting encounters with others.
Yeah.
Exposure, high exposure is when both parties are not wearing a mask, they're within 6 feet of each other for more than 10 to 15 minutes, not seconds. When you're in
Yeah.
a park, that's a fleeting encounter. You're around each other for half a second. So I
Yeah.
personally do not think masks are necessary. But that tragic story, I think it's very, very difficult as a physician for me to accept that the mask had anything to do with that death. I could be
Mm-hmm.
mask and drop dead because I had a heart attack or an embolism in my lung. So I think that's a coincidence, and we should not link it to wearing the mask.
Fair enough. But you would say that in an open space where you're not running into people at close encounters for any significant length of time, a mask is not necessary, which takes me to the CDC confusion over the aerosol spread. What do we know? Does this virus spread through the air or not? And is the 6 feet distance, 6 गज की दूरी जो यहाँ बोला जाता है, क्या वो काफी है या नहीं, फहीम साहब?
जी, 6 गज की दूरी बिल्कुल काफी है क्योंकि अगेन जिन मुल्कों ने इस जंग को जीता है वो 6 गज की दूरी से जीता है. The issue of aerosol is once again in that 10% where we don't know everything, but this is what we do know. It happens under certain circumstances. What that is, if I have COVID and if I am highly infectious and I'm sitting in front of an air conditioner in a closed space in a restaurant, of course,
Yeah.
that's common sense that air current is now going to take my droplets more than 6 feet away. You don't need a study for that. That's common sense, right?
Yeah.
So if you have a patient and has COVID positive and you're putting a tube in their lung and just churning everything up, of course they're going to cough and this aerosolization is going to be suspended. So under those conditions, yes, it is airborne. But by and large, once again, for the general public, I don't think the focus should be on airborne. I think that creates hysteria. I think it takes people away from common sense precautions like a mask, and it creates मायूसी फैल जाती है एक लोगों में. Like people feel
जी.
like nothing I can do. So once again, I strongly disagree, even with some of my physician colleagues, because I believe these are very important conversations. They just don't belong on Twitter and social media, because we're
Yeah.
trying to create unification here. Just unify the people around 80-90% of the facts and kill the pandemic. That's my focus.
So then the next question you'd find, in a sense, panic-driven, क्योंकि चंद्रशेखरन का सवाल है, do droplets of perspiration pass the infection? तो इनको आप क्या बोलेंगे?
No, they don't.
No? Okay.
No.
Okay. So I think what I'm hearing you say is let's not focus on the minute outlier issues. But you know what people worry most about are children and their elderly. So I'm going to put up my own question, COVID and children, what do we know? And again, I don't know if this is outlier data. I don't know what your data tells you. But in India, we do have cases of children recovering and then developing post-recovery inflammatory disorders, where the post-recovery complications that have taken place have almost been more dangerous than the COVID infection, right? And I did a report on 9 children in one Pune hospital where this was happening, and the children were all in the, they were younger than 10 years old. So I'm just wondering what you've learned about this that can help us.
Sure. So every life is important. Every person's suffering is important. It's very, very difficult when we start quantifying suffering, but unfortunately in public health, that's what you have to do. You have to see how many people will die of a vaccine and how many people will die of a disease. And if that comparison is 100,000 to 1, we go to a vaccine, right? We accept that calculated risk. So once again, my request is that we contextualize all of these things. We have nearly 6 million patients in India right now. And I believe every country, not just India, I think every country is undercounting, because we just cannot just test everyone every day. So the reality is only going to be more than that. So out of 6, 7, maybe 10 million people that are infected, if we have 9 children, that's the context, I believe. And
That's fair.
Once again, my point really is children are very resilient. When children, I have my own children, I've always told people when a child is suffering, usually it's the parent who's really suffering even more than the child.
Yeah.
God has created children such they don't remember these things. They will come out of it stronger. So this is the time for us to give each other hope, give each other some energy, and still remain true to the science. Don't give false hope.
I think you make a fair point that those 9 children, while as a journalist it's a valid story in the larger picture of India crossing 5 million at the official number, maybe many more as the Sero Service tell us.
Sure.
Those 9 children are not a huge thing to panic about. But parents are asking you, children want to come out and play. Is it okay for them to wear a single layer cloth mask and go outside and play?
Yeah, very difficult question. Once again, if disease is well controlled in your area, which I mean 5, 7, 8%, what people have done is they have these pacts. 4 or 5 families will say, look, our children will only play with each other. They're not going anywhere else. We're trying to limit all other contact. And if anybody develops any symptom, please don't send your child. So there are common sense approaches people are doing to try to mitigate their risk. Once again, the job here is to try to minimize risk as much as possible, not to get it to zero. We will never be able to get it to zero. My children go out and play under controlled circumstances. So as long as you can put some control and discipline around it, look at your local positivity rate and then make a decision.
Okay, I want to come to something else that's happened. One of the unusual things that happened in India, which did not happen in the US, is that public transport actually shut down during the lockdown, which means that even domestic flying stopped. Now, in America, by contrast, airports were open even though people may have been choosing not to fly, right? Since domestic flights have opened in India, actually, there is no data to show that flying is dangerous. Of course, people are wearing face shields and masks and flying, but this is a good thing. And explain this to us, because airplanes are closed spaces, the air is recycled, but people are flying and this gives us hope. And literally there's nobody, different states and different airports have their own rules. Some require COVID testing, some don't. What would you say about flying in the age of Corona?
Sure. Once again, nothing is risk-free, but flying, I don't believe, is a high-risk activity. If you look at mega super spreader events, none of them are linked to an aeroplane. They've been linked to places of worship. They've been linked to large weddings. They've been linked to all kinds of other gatherings, but none of them have been linked to an aeroplane, because aeroplanes have a filter. There is a HEPA filtration system in the aeroplane. So the air is not just recirculated, it's also filtered. And when everybody is wearing a mask, and usually people are not sick who are on the plane, and you're doing hand washing and you're being careful, chances are you'll do well. And I don't want to, again, my job here is to stay the balance. So if I go in one extreme, your job is to call me out. I'm not trying to make people complacent. And I'm not trying to create a panic. I want to make sure we stay behind the science. So currently the science says if your travel is necessary, I think it's reasonable to go with precautions. If it's a leisure vacation that you can delay, yes, use your common sense and delay it.
But why should we then not open up international flying more than we have? We know from the domestic sort of travel that it's not dangerous, as you just explained, right? And I don't think anyone feels like sort of taking a holiday right now for the heck of it. But yes, people may need for their own mental well-being just something normal to do. There's also the economic dimension. There's a serious economic activity curtailment that has taken place. Affiliated industries are damaged when planes don't fly, when people don't travel. And that is why I'm pushing you on this question.
I completely see your point, but this is why I said I don't comment on policy, because it requires, I'm a data-driven man.
Sure.
I have to see a lot of data before answering that question. I would like to quantify that human impact versus economic impact versus an industrial impact. And I don't have that data. And I think this is another thing that this pandemic has taught us. If all of us just swim in our own lanes, meaning if I just say only what medicine tells me, and at the same time, with all due respect, if politicians only say what politics is and not get into medicine, and economists only talk about economy, I think we would be a much better world. The problem is we're all tempted to go into each other areas, and I try to resist that temptation.
Fair enough, but you are looking at countries who have chosen a very different approach to this. Large parts of Europe, for example, have opened, right? Boris Johnson was initially betting on herd immunity, that there was too much pressure on him. England had opened up, and now again there are some restrictions. For example, pubs and bars are going to close at 10 p.m. and so on. How do you look at those parts of the world that decided to approach this without a lockdown approach? And I'll tell you why I'm asking you this, because I started off as a votary of the lockdown. But when I traveled across India and I had the opportunity to do about 24,000 kilometers across the country, I started thinking that for our reality, for the reality of countries in our part of the world, the lockdown was not a good idea. The lockdown was only meant to prepare our health system for everything else. You know, we're a country where 90 million households live in one room accommodation. So when you say to these people, stay at home, it's a meaningless thing because sometimes 8 लोग हैं एक कमरे में, तो आप क्या उनको stay at home बोल रहे हैं? So I'm asking you what you think about the lockdown per se, especially because in the US it's such a political debate where, you know, when Trump and the Republicans want to open up, it's seen as a kind of self-indulgent thing. लेकिन हमारी देश में तो ये एक survival की बात है और मुझे लगता है हमने West से copy paste कर लिया ये formula और हमारे लिए ये ठीक नहीं है.
I think आपकी बात दुरुस्त है. और देखिए, lockdowns, I've always said, they are like you said, lockdowns are meant to build capacity. अब 2-3 हफ्ते के लिए लॉकडाउन करते हैं ताकि हम टेस्टिंग इम्प्रूव कर लें, ट्रेसिंग सिस्टम डाल लें, थोड़ा सा लोगों को एजुकेट कर दें, एंड देन यू रीस्टार्ट, राइट? यू आर ओनली प्रिपेयरिंग. लॉकडाउन इज नॉट अ परमानेंट स्टेट. और जो आपने दूसरी सिचुएशन भी बताई है, जो रियलिटीज हैं हमारी मैस रियलिटी, so this is why I keep going back to wear a mask, wash your hands, maintain as much distance as you can, and live your life.
Yeah.
Common sense पे रखिए, लेकिन उसमें जो आप कर रही हैं, जो मीडिया कर रहा है, if we are all aligned in the media, this kind of conversation, and there must be lots of very smart doctors in India, and I have huge respect for them. I would say give them more airtime ताकि वो लोग जो साइंस के साथ aligned हैं, रोजाना लोगों को मैसेजेस दें, बिकॉज इस पे कोई खर्च नहीं आता. दिस इज द चीपेस्ट मोस्ट अवेलेबल थिंग. और हमारे लोगों के पास डिजिटल डिवाइड भी हो तो खबरें सब सुन रहे हैं. सो आई थिंक वी विल हैव टू जस्ट कीप देम एजुकेटेड इन द मिडल एंड लेट देम लिव देयर लाइफ. अदरवाइज एक्सट्रीम्स पे कोई सर्वाइवल नहीं है, ना अमेरिका में ना इंडिया में.
अमेरिका को लेके एक सवाल है अमीन से, what could be the possible reasons that there are more deaths in America than in India due to COVID? Now, this is a very interesting question. And I was, in fact, interviewing oncologist and virologist Siddharth Mukherjee, and he said this is a mystery. Nobody has been able to understand why fewer people are dying here, thank God. But एक theory है कि हम लोग की exposure to zoonotic viruses इतनी ज्यादा already है कि immunity एक तरह से ज्यादा है. What do you make of the data coming? Of course, we're factoring in that deaths have been undercounted, but even factoring that in, as a percentage of population, it is true that many more people are getting the disease here, but much fewer people are dying from it.
Sure, मुखर्जी साहब की बात बिल्कुल ठीक है. This is very complex and we will know this in hindsight. 5-10 साल के बाद जब हमारे पास मुकम्मल डेटा हर तरह का आ जाएगा and we'll be able to put things together. लेकिन I think there are some theories. Of course, average age in America is much higher than India. India has a younger population. The disease doesn't kill younger people as much as it does older people. So of course, ये एक possibility है. America का social system in nursing homes there are many nursing homes. There are areas which are conducive for older people to live together. India may not have that same structure to the same degree. America की जो deaths हैं, they are much more likely in underprivileged people, in African Americans, in Hispanics, जो गरीब लोग factories में काम कर रहे हैं, जिनके पास healthcare access नहीं है. So there are millions of such people. And then of course the final thing is testing. मेरे ख्याल में it's very possible कि इंडिया में ऐसे लोग होंगे कि जो शायद हार्ट अटैक से मर रहे हैं, घर में फौत हो रहे हैं, फालज से मर रहे हैं, लेकिन अल्टीमेटली उनको अंडरलाइन कोविड था जो कि टेस्ट नहीं हुआ. सो देयर ऑल ऑफ दीज फैक्टर्स. और ये भी हो सकता है कि क्रॉस इम्यूनिटी हो, जैसे आपने कहा. वी डोंट नो दैट टुडे because the viruses circulating in that part of the world could be different than the virus circulating here. Maybe there is some partial immunity. थोड़ी सी कोई ऐसी डिफेंस मैकेनिज्म है बॉडी में which does better with this virus. लेकिन these are all theories, we don't know for sure.
पर अगर आप मैं मतलब एक उदाहरण मिसाल के तौर पर आपको देती हूँ कि अमेरिका से कोई लोग दिल्ली आते हैं तो वो सड़क का पानी या गोलगप्पे या चाट खा लेते हैं तो उनका पेट खराब हो जाता है, लेकिन हम लोग खाते हैं तो हम ठीक रहते हैं. So there is something to be said for the fact that we're a hardier people. We've been a poorer people, but we're hard. I know it's different. That's why I
think this is
simple example diya hai. But the data does tell you that fewer people are dying in this part of the world. The data does tell you that, right?
As I said, मेरा ख्याल है कि this is where I would see it differently. मेरा ख्याल है data is very incomplete. We are in data fog. और जो hardier people की बात है उसके लिए तो बड़ा एक simple metric है, life expectancy. अगर हम नहीं हार्डियर हो तो हमारी लाइफ एक्सपेक्टेंसी ज्यादा हो ना फिर यूरोप और अमेरिका से, जो कि नहीं है। सो ये चीजें देखें, मैंने अपनी आधी जिंदगी दुनिया की वहां गुजारी, आधी यहाँ गुजारी है। सो आई हैव नो स्ट्रॉन्ग हार्ड
So
लॉयल।
what is your working theory when you look at the numbers? What is your
मेरी
working theory?
वर्किंग थ्योरी ये है कि स्मार्टनेस इस चीज का नाम है कि वी शुड अस्यूम कि वी आर नो डिफरेंट देन एनीबॉडी। देखें, ये एक जिंदगी में तरक्की का राज है। इसको कहते हैं प्री ऑक्यूपेशन विद फेलियर। जो अक्लमंद लोग हैं, जो सक्सेसफुल लोग हैं, वो हमेशा ये सोचते हैं कि क्या गलत हो जाएगा, क्या गलत हो सकता है। दे आर ऑलवेज थिंकिंग ऑफ बैकअप प्लान्स इन देयर माइंड। दे आर नॉट कंप्लेसेंट, दे आर नॉट लुकिंग फॉर रोजी पिक्चर्स, दे आर एक्चुअली अस्यूमिंग द वर्स्ट केस सिनेरियो, एंड दैट इज हाउ दे गेट टू द माउंटेन टॉप। तो हमें अपने लोगों को ये बात नहीं बतानी कि तुम स्पेशल हो। हमें उनको बताना है तुम उतने ही रिस्क पे हो जितना अमेरिका है, जितना इटली था, जितना अमेरिका स्पेन था। वर्क हार्ड, गेट देयर, एंड दिस इज हाउ। मतलब वर्ल्ड कप जीते हैं इंडिया ने तो कैसे जीते हैं? इस तरह जीते हैं ना। सो आई थिंक दैट्स द होल मेंटालिटी, एंड आई ब्रिंग दैट एग्जांपल बिकॉज मैंने अपनी आंखों के सामने इंडिया की क्रिकेट टीम को ट्रांसफॉर्म होते देखा है। सो देयर इज अ मैसेज देयर। वही हमें अपनी पूरी कौम को वो मैसेज देना है। डोंट बिकम कंप्लेसेंट, डोंट थिंक यूर स्पेशल, यूर जस्ट
Okay, fair
लाइक
enough.
वर्क हार्ड।
Fair enough. Okay, next question. And this is an important question because I know that one of the things, Dr. Faheem Younus, you've been doing on your Twitter feed is myth busting, right? You've been calling out, there's all kinds of, granny's tales, and I have nothing against granny's tales when they work, but do they work? So the question from Parth Mukherjee, does drinking warm water, herbal tea, haldi milk have any immunity booster effect? And is there any scientific study to support this theory? Now, this said, turmeric, this is the perfect example, जिसको हम हल्दी कहते हैं, of cultural appropriation. आप आज अमेरिका में जाएं, कम से कम पैंडेमिक से पहले जब जाते थे तो हर स्टारबक्स में आपको टर्मरिक लाटे मिलता था और मैं कहती थी ये क्या हुआ हमारे हल्दी दूध को। पर cultural appropriation notwithstanding, what would you say to Parth Mukherjee? Are there any immunity boosters that people can do to keep themselves, healthy?
तो देखिए, ये बड़ा इंटरेस्टिंग क्वेश्चन है और यकीनन बहुत सारे लोग नाराज होंगे। वन डे आई कम टू दिल्ली, जितने मेरे भाई हैं, आई हग यू, मैं आपसे माफी मांग लूंगा, बट आई गोटा टेल यू द ट्रूथ। आप मेडिकल जर्नल्स उठा के देख लें, इम्यूनिटी बूस्टर के नाम की कोई चीज नहीं है। दिस इज अ मेड अप थिंग। ये हमने एक फियर फैलता है जब, तो उस फियर से बिजनेस अपॉर्चुनिटीज भी निकलती हैं, हर तरह की अपॉर्चुनिटीज निकलती हैं। एंड आई डोंट वांट टू क्वेश्चन एनीवन्स इंटेंट। मेरा ख्याल है पीपल आर ऑल वेल इंटेंशन्ड, everybody trying to play their role, everybody is trying to help in this pandemic, जो कि एक अच्छी बात है। लेकिन द रियलिटी इज कि हमें उन प्रूवन चीज़ों के साथ रहना चाहिए जिनका हमें पता है। 8 hours of sleep helps your immunity, having a balanced weight helps your immunity, living a stress free life helps your immunity, अपना वेट कंट्रोल करें, रेगुलर एक्सरसाइज helps your immunity। लेकिन गोलियां खाने से, मजूने खाने से एंड ऑल द अदर होम रेमेडीज, दे मे मेक यू फील गुड, लेकिन हमारे पास कोई डेटा नहीं है, हमारे पास कोई प्रूफ नहीं है इसका। अब आप ये कह सकते हैं कि जब प्रूफ नहीं है तो मुझे क्यों रोकते हो? भाई, आपको नहीं रोकते, आप जरूर खाइए, लेकिन एक गुजारिश ये है कि इसको प्रमोट मत कीजिए। आप कहते हैं क्या फर्क पड़ता है? आई फील गुड, मुझे इससे तसल्ली मिलती है। देखें, फर्क ये पड़ता है, इफ यू ऐड मोर वर्ड्स टू व्हाट शेक्सपियर रोट। अगर आप गालिब की गजलों के अंदर और उर्दू लिखनी शुरू कर देंगे तो गालिब को फर्क नहीं पड़ेगा। अगर आप आइंस्टाइन के अंदर अपने लफ्ज ऐड कर देंगे तो थ्योरी ऑफ रिलेटिविटी को फर्क नहीं पड़ेगा। व्हेन यू ऐड समथिंग टू समथिंग दैट्स क्लासिकल, दैट्स साइंटिफिक, यू डाइल्यूट इट, यू एक्चुअली मेक इट करप्ट। तो ये जो साइंस है पब्लिक हेल्थ की, जब हम इसमें अपनी चीजें ऐड करते हैं तो हम उसको करप्ट कर रहे होते हैं, उससे हम मैसेज डाइल्यूट कर रहे हैं, क्योंकि यू कैन ओनली हैव सो मेनी बॉल्स इन द एयर। एक शख्स के लिए यही याद रखना बहुत मुश्किल है। मैं खुद ये रोज प्रैक्टिस, आई एम टेलिंग यू, इट्स नॉट इजी टू वॉश योर हैंड्स ऑल डे, टू वेयर अ मास्क, टू अवॉइड क्राउड्स, इट्स वेरी डिफिकल्ट। उसके ऊपर 4 चीजें जब और ऐड करते हैं तो हम वो कर रहे हैं कि अब हमने आइंस्टाइन की थ्योरी में अपनी चीजें ऐड की और हमने कैसे, क्या नुकसान होता है? आई फील गुड। वेल, यू मे फील गुड, प्लीज अपने घर में कीजिए, प्रमोट मत कीजिए इसको।
Fair enough, because there are other questions coming in, for example, and I'm assuming your answer would be the same on vitamin C.
बहुत मार पड़ेगी लोगों से इस क्वेश्चन पे, but I'm not afraid of speaking my truth.
बढ़िया है, सबको अपना जो आपकी समझ है आपको आगे रखनी चाहिए। Prince has a question on vitamin C. I guess your answer would be the same on vitamin C.
जी, there are conflicting reports. I'm not eating it. I'm not giving it to my family. मेरे ख्याल में कोई इतना hard evidence अभी हमारे पास नहीं है जो convincing हो।
So I want to come back to therapies and preventives, right? There was a huge debate on hydroxychloroquine. And I think we now know that, I don't know. I mean, I don't know about your views on it as a preventive, but at least therapeutically, it isn't working, right? Does the data tell us that?
Sure, there are now dozens of studies. हर तरह की studies अब इस पे हो चुकी हैं. It does not prevent, it does not cure, and it does not do anything to the long-term side effects. और देखिए मैंने कई दफ़ा ये बात कही है कि minds are like parachutes, they work best when they're open. और मैं ये अपनी बात बताने लगा आपको. मार्च अप्रैल में मैंने खुद बहुत यूज़ किया हाइड्रोक्सीक्लोरोक्विन अपने पेशेंट्स के ऊपर. मैं अब तक hundreds of patients हम देख चुके हैं अपने हॉस्पिटल में. So I was a big proponent of it. लेकिन एट द सेम टाइम उसके बाद हमें पता चला जब डेटा आया कि इसका फ़ायदा नहीं है, फिर मैंने यूज़ बंद कर दी. यू नो, यू फॉलो साइंस. अगर कल और ज़्यादा कन्विंसिंग डेटा आ जाएगा कि वो यूज़ उसका फ़ायदा है, आई विल स्टार्ट अगैन. इसी को साइंस कहते हैं और यही हमारी लाइफ रही है हमेशा. फ़र्क सिर्फ ये पड़ा है कि नाउ mass public has seen the difficult decision that we as physicians have to make. लेकिन में कोई नई चीज़ नहीं है हमारे लिए.
So you're saying you were using hydroxychloroquine earlier and now you are not?
I am not using for any circumstance because there is no conclusive scientific data. And I know there are a lot of YouTubers out there, a lot of politicians, a lot of people who will swear their life on it. Unfortunately, जब आप उनके credentials देखते हैं, तो उनके credentials में कोई ऐसी चीज़ नहीं है कि they have been doing infectious diseases for 20 years. They're all sort of seasonal experts, with all due respect.
So you were using it, you're not using it now, but you're not using it as therapeutic, or you're not using it as a preventive for frontline workers either?
Either way. We had doctors who were taking it as a prevention in the beginning क्योंकि सब लोग frontline पे काम कर रहे थे. ना मैं खुद खा रहा हूँ, ना मैं किसी पेशेंट को दे रहा हूँ. और हमारे पेशेंट्स का सर्वाइवल एक्चुअली 30, 40, 50% इम्प्रूव हो गया है. दिस इज इंटरेस्टिंग कि जो सर्वाइवल था, मैं लोगों को कहता हूँ कि if you wanted to be a COVID patient, it's much better to be a patient now as compared to April. जब हम hydroxychloroquine दे रहे थे. So survivals are improving and they'll probably continue to improve.
So what is the therapy that you believe is working? Because there's a debate, you've answered on the HCQ, but there's a debate raging around plasma therapy. There's a debate raging around blood thinners. There's a debate raging around remdesivir. What are you finding is actually working?
So सबसे important बात मैं ये कहूँगा कि please nobody should self-treat themselves. क्योंकि मुझे पता है कि in that part of the world things are available from the medical stores. Please do not be your own doctor. You'll kill yourself. There are hundreds, if not thousands of people who literally have died because of self-medication. Number one. जो simple rule है इस वक्त COVID का, जो 80 to 90% लोग जो hospital नहीं आते, जिनको ऑक्सीजन की ज़रूरत नहीं होती, they don't need anything fancy. आप पैरासीटामोल ले लीजिए, आप आइबुप्रोफेन ले लीजिए, आप गरारे कर लें, आप हल्दी खा लें, whatever you like, because you're likely to get better. It's a fight with your virus and immune system. 10, 12, 15 दिन में आपने वो जंग जीत जानी है. 99.5% of the people are going to win that war. So for that, and I know this is not satisfying answer क्योंकि हम designed हैं. अब हम designer clothing के ज़माने में रहते हैं. हमें पुरानी Honda या Toyota का मज़ा नहीं आता. Everybody wants a Lamborghini. लेकिन ये है कि this virus is simple. Stay simple with it. कोई complexity, fancy treatments की ज़रूरत नहीं है. Once you go to a hospital, first of all, trust your doctors. लेकिन hospitals में जो चीज़ हमारी सबसे ज़्यादा valuable है इस वक्त, that's it, 3 things. We use anticoagulation, which is blood thinners. We use dexamethasone, which is proven in the registry trial from from UK. और तीसरी चीज़ we use remdesivir. मुझे पता है remdesivir बहुत ज़्यादा अवेलेबल नहीं है, महंगी भी. लेकिन रेमडेसिविर का कोई मोर्टेलिटी पे फ़र्क नहीं है. अगर रेमडेसिविर नहीं भी मिलती तो बिटवीन एंटीकोएगुलेशन, ऑक्सीजन सपोर्ट एंड डेक्सामेथाजोन द ओवरऑल मोर्टेलिटी शुड इम्प्रूव. मुझे नाम नहीं याद आ रहा उसका, फेवी करके कोई नाम है, लोग मेरे से पूछते हैं that used in India. The trials are still going on that drug. I cannot comment any further. मैंने बहुत ज़्यादा उसके बारे में डेटा ना पॉजिटिव देखा है ना नेगेटिव देखा है. लेकिन again, stick with what is proven. Don't add new things into it.
And in most cases, you would advise people to stay at home. I think that's the important thing. We were seeing a mad rush for hospitals in the beginning, right? But in most cases, you'd say stay at home. The other thing I want to ask is, we started off thinking we needed ventilators. We now know that actually we don't need ventilators, we need oxygen. And in India in particular, the demand for high flow oxygen in hospitals has doubled compared to what it was pre-pandemic levels. I'm just wondering what you're finding on the oxygen vis-a-vis ventilator argument in the US. And two, is the oximeter, just a oximeter that you can buy from any local pharmacy, the best way to kind of know if you're anywhere near COVID?
Excellent question once again. Isme bhi again evolution of science hai. When the disease first came out, the idea was to intubate people early, put them on a ventilator very, very quickly. Then we realized actually we were killing people. That was not good. Now the idea is to delay ventilation as much as possible, put them on oxygen and try to gain as much time as possible. और हमारे कई पेशेंट्स हैं 10-10 दिन ऑक्सीजन पे रहते हैं, उनको वेंटिलेटर की जरूरत नहीं पड़ती, and then they go home. So ये बात आपकी बिल्कुल ठीक है. I think what we need more is oxygen as compared to ventilator. Oximetry की जहाँ तक बात है, pulse oximetry की, I'm not a big fan of it, and for the following reasons. Number one, pulse oximetry is a monitoring tool, not a diagnostic tool.
Okay.
आप diagnose नहीं कर सकते कोविड को. Number one. Number two, there are many other diseases. अगर कोई सिगरेट पीता है, एम्फीजीमा है, COPD है, एस्मा है, निमोनिया है, बूढ़ी उम्र है, स्काइफोसिस है, बहुत सारी और कंडीशंस हैं जिसमें पल्स ऑक्सीमेट्री नीचे जा सकती है. वो लोग समझ शुरू कर देंगे मुझे कोविड है, विच इज़ रॉन्ग. इसका जो एक बेनिफिट मुझे नजर आता है वो ये है कि इफ समबडी हैज कोविड एंड दे वर इन द हॉस्पिटल एंड देयर ऑक्सीजन इज लो, अब आप उस पेशेंट को घर भेज रहे हैं, जी शायद फायदेमंद है. उसको कहें ये पल्स ऑक्सीमीटर साथ रखो, अगर 90 से नीचे चले जाए तो वापस आ जाना, वहाँ शायद इसका फायदा है. लेकिन अदर देन दैट जनरली इससे एंजाइटी और पैनिक फैलेगी और कोई फायदा नहीं होगा.
लेकिन एक रति सक्सेना का सवाल है, कैन वी यूज ऑक्सीजन एट होम, कैन वी एडमिनिस्टर ऑक्सीजन एट होम? आई एम गेसिंग द आंसर इज नो. एट लीस्ट इन इंडिया यू गेट लिटिल ऑक्सीजन सिलेंडर्स, पीपल विल स्टार्ट ऑक्सीजन होर्डिंग. दूसरी तकलीफ तो ये होगी.
छोटी सी बात बता दो, ऑक्सीजन इज हाईली इन्फ्लेमेबल. अगर किसी ने माचिस फेंक दी वो बम की तरफ हटेगा. सो पीपल डोंट अंडरस्टैंड दीस स्मॉल थिंग्स कि ये सब रिस्की काम है. हो तो सकते हैं, मैं मतलब मना नहीं मैं करता किसी को, लेकिन देयर आर रिस्क्स एसोसिएटेड विद डूइंग थिंग्स ऑन योर ओन. बेस्ट ये है आप हॉस्पिटल जाइए, डॉक्टर अगर आपको देखे, उसके बाद डॉक्टर कहे कि अंडर दिस कंट्रोल्ड एनवायरनमेंट आप ऑक्सीजन ले लें, तो हाँ अपने डॉक्टर की बात मानिए. आई ट्राई नॉट टू गिव पर्सनल मेडिकल एडवाइस,
एंड द वर्ल्ड,
मुझे खौफ आता है किसी की जान है इसमें, तो आई वांट टू वैल्यू योर लाइफ.
No, and sorry, I didn't mean to interrupt, but it's also important to underline that not everybody will need oxygen. Absolutely. Even according to the WHO's own data, 15% of maximum, at a maximum.
Probably less than that. 85 to 90% of the people will not need oxygen.
Now, we were trying to remember the name of that medicine that starts with F. Even I couldn't remember, but a viewer has helped us. The medicine name is Favipiravir. 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 I don't even know if I'm saying it right. Yeah.
तो वो लोगों ने मेरे से कई दफा पूछा है ट्विटर पे, and I'll tell you, if I don't answer a question, उसकी सिर्फ दो reasons हैं. या मैं busy होता हूँ, मैं दिन में 2-4 दफा, because this is what I'm living every day. So when I think something is relevant, I quickly tweet and then go back to my work. I cannot keep up with my notifications. So या तो मैंने आपका question पढ़ा नहीं. दूसरा ऑप्शन ये है कि मैंने पढ़ा है लेकिन वो मेरे एरिया ऑफ एक्सपर्टीज में नहीं है, and I don't want to just Google something and wing it and try to appear smart. Nobody knows everything. तो मुझे जो पता है मैं कोशिश करता हूँ आपकी खिदमत में हाजिर कर दूँ, but I don't know everything.
Okay, most of, not most, but many questions we're getting are repeatedly on schools, on colleges. Now, you know, the NEET-G students who try to reach out to you, exams hone chahiye, nahi hone chahiye. You've already said you don't want to get into policy, but as a principal, again, there's a question. Even if schools are tough, should colleges open? What do you think, sir? This is from Ronit.
बहुत मुश्किल. Again, it depends on so many variables. As I said, आपका community positivity rate क्या है? If the community positivity rate is 10%, chances are it's a bad idea. If the rate is 3%, आप खोल सकते हैं. आपकी testing कितनी available है? आपके hospitals में capacity कितनी है? आपके overall population का risk कितना है? Are you on the peak or are you coming down from that peak? आपकी trend line क्या है? बहुत सारे factors हैं इसमें, and I would say the local authorities, I would trust them. They have a very difficult job. They are really balancing too many factors here. So मैं खुद भी, and you can imagine, मैं अमेरिका में रहता हूँ, सोचे मेरे लिए कितना मुश्किल है इस वक्त गवर्नमेंट के साथ अलाइन होना. हमारे प्रेसिडेंट साहब क्या क्या कह रहे हैं सारी दुनिया के सामने.
Is that how do doctors deal with Trump, by the way?
Well,
laugh and dismiss it.
I come home every day and my children bring sanity back to me. I look at them and I say, yes, life is worth living. Don't shoot yourself. So it is very hard. It is absolutely difficult. So you can imagine I'm still trying to follow all the guidelines here. So आपको भी वही कह रहा हूँ जो खुद कर रहा हूँ. There is ease after hardship. The reality is इसमें कोई शक नहीं कि ये COVID will die out and mankind will be standing. There is no doubt in my mind about that.
Yeah.
और दूसरी ये बात है कि स्पेनिश फ्लू में भी 1/3 of the world, 33% of the people in the world got Spanish flu. जब किसी को पता भी नहीं था कैसे बचना है. अब जबकि इतनी इंफॉर्मेशन है, many of us, I think good 70-80% of the world will not be infected and we'll be able to crush this pandemic.
But something very important you said about schools and colleges is that there need not be a uniform policy for an entire country, whether it's India or anywhere else, because there are regional variations, there are states that are doing better, there are cities that are doing better, and therefore there should be a blended model. We don't actually need a national one-size-fits-all rule on this.
You need criteria. और जहां जहां वो criteria meet होते जाएं, वहां वहां आप खोलते जाएं, बंद करते जाएं, right? You need a set of criteria so people know as well. देखिए जब patients मेरे से पूछते हैं मैं घर कब जाऊंगा, I tell them when your fever is normal, when your white cell count is normal, when your culture is negative, I'll send you home. So you can ask your nurse every day about these 3 criteria. So I think one thing which people can do, with the governments perhaps can do to settle this angst, दिलाना चाहिए. Perhaps come out with a set of criteria and say when these criteria are met, maybe Kerala has met those criteria, will open schools in Kerala. Maharashtra में नहीं हुए तो अभी नहीं खोले. So that may be okay.
तो फहीम साहब, दिल्ली में जिम्नेजियम्स खुल गए हैं, उस पर सवाल है अनिरुद्ध का. How about going to the gym? Is it safe, doc?
बहुत मुश्किल क्वेश्चन once again because I want to hurt someone's business. मुझे अंदाजा है कि ये businesses हैं लोगों के, लेकिन the science says कि indoor is a high risk environment. Outdoors is better. So anything indoors, whether that's a restaurant, whether that's a gym, ये सोच लीजिए कि that is a high risk environment.
So restaurants have opened in the national capital in many cities. Again, what does the science tell us? And I will again say, how long can we live like this, doctor? How long can we live with our economy closed? Will we reach a situation where economic hardship, where poverty, where job losses will become more lethal than the virus?
Of course, again, be sane. Restaurant जरूर जाइए, बाहर बैठ जाइए. Don't sit inside. अगर अंदर social distancing के साथ उन्होंने limited capacity रखी हुई है, many restaurants are doing 30%, then that's fine. Just always, when you are out there, always look for how close can I be to the ideal state of wearing a mask, washing hands, and making distance.
But Faheem साहब, ये हमारे एक कल लोकल ट्रेन की इमेज है. मुझे मालूम नहीं आप देख पा रहे हैं या नहीं. भरी हुई चकाचक ट्रेन है. आप you are from this part of the world, so you know what our bastis are like, what our public. These are people who have no other option. मुझे कई बार ही लगता है कि ये जो हम सोशल डिस्टेंसिंग कहते हैं ये एक बहुत ज्यादा एलीट कॉन्सेप्ट है. हम समझते ही नहीं कि गरीब आदमी के पास ये तो ऑप्शन ही नहीं है. तो मुझे कई बार ही लगता है कि लॉकडाउन जो है अमीर लोगों को सेव करने के लिए है और गरीबों को पनिश करने के लिए.
अब आप बहुत ये बड़ी स्टार्क रियलिटीज हैं और ये ट्रेन वगैरह के इमेजेस मैंने बहुत देखे हैं. इसीलिए आई ऑलवेज ट्राई टू क्वालिफाई व्हाटएवर यू कैन डू. देखिए सब इम्पोर्टेंट बात अभी भी ये है कि व्हेन ह्यूमन माइंड इज फोकस्ड ऑन समथिंग, जब ये चाहती है ना कि मैंने बच्चे के लिए दवाई लानी है, तो वो अपना पेट काट के भी ले आती है. बाप को कह लें बेशक. All I'm saying is please agree to the principle. उस प्रिंसिपल को अग्री करने के बाद जो आप कर सकते हैं वो करें, जो आप नहीं कर सकते then there are bigger forces beyond human beings जो फिर ऐसे वक्त पे इनैक्ट करती हैं. So I do believe कि जब लोग well intentioned होते हैं there are other forces. फिर खुदा काम करता है, लोग उनकी हेल्प करते हैं.
Okay, we have just about 2 minutes left with you. So post-COVID precautions, there are questions coming in on that. And also if you could talk a little bit about long COVID. I've been interviewing people who've recovered, but then they say, we don't feel like we did before. We don't know how much of this is anxiety because there's so much paranoia about this disease. They complain most commonly, as you know, about chronic fatigue, about hair loss, about difficulty in breathing, right? And these are reasonably fit people. So Rahul Sharma has a question. What are post-COVID precautions that may help? Please ask the doctor to say something about post-COVID.
Gee, I don't know if there is any precautions to prevent it. And I know that it happens. but that's all I know. And I think anybody who tells you more than that is probably making up the facts. We
Yeah.
don't know how common it is. We don't know who is more at risk, men or women, young or old. We don't know how long it lasts, 2 weeks, 2 months, 2 years. So there are a lot of unknowns. And once again, what I will tell you is there are many other viral illnesses. They all can cause some post viral syndrome. So
Yeah.
today, I'm hoping, based on my 20 years of experience, that when we look back 10 years later, hopefully the post COVID will not be anything more than other viruses. But here's a caveat: none of those viruses got the attention of a pandemic. So it's
Right.
going to play on our psyche for a very long time.
There are senior citizens who are asking if it's safe for them to take a walk.
Absolutely. Nothing is 100% safe, but please take a walk. That's a good thing for your health, for your immunity. Just again, follow those precautions. Wash your hands, maintain as much distance as you can, and wear a mask.
And should you be wearing a mask when you're cycling?
Probably no.
Because someone, as Mujtaba says, wearing a mask reduces my ability to breathe freely. Is having less oxygen intake, not an issue?
That's why I said probably not. It's better not to wear a mask while you're exercising. लेकिन again, अब मुझे वहाँ की realities का नहीं पता. If you're in a very crowded area, you feel comfortable better. Do understand one thing before we go.
Yeah.
Everything I tell you today is subject to change. That is how science is. And if I came across arrogant in something, I apologize, because that's not how scientists should be. We should be factual, we should be straightforward, but change is the new norm. Change is expected. इसका मतलब ये नहीं है कि मैं आज आपसे झूठ बोल रहा हूँ. अगर 6 महीने बाद मैं आऊँ और मैं कुछ और कहूँ, you can't pin me down. क्योंकि this thing will change and we have to change with the science.
मुझे तो ये भी याद है सर, जब WHO कह रही थी कि मास्क पहनना जरूरी नहीं है. So things have changed so dramatically. Before you go, and I know it's midnight where you are, where are we on the vaccine? So many people want to know, where are we on the COVID vaccine?
So I think there are hundreds of vaccine candidates. 8 or 9 are now in the last phase, which is phase 3, जिसमें 10, 20, 30 हजार लोगों पे वो वैक्सीन ट्रायल होता है. I believe कि 3 या 4 वैक्सीन most likely इस साल में अप्रूव हो जाएंगी. मैंने कल ही पोस्ट किया था कि many countries are now pre-ordering the vaccine for themselves. There's a list of countries on my Twitter feed. You can see that. Now the questions remain कि वो vaccine launch होने से common man तक कितनी देर लगेगी. Every pipeline is different. You order a Tesla car today, you're not going to get it tomorrow, right? You're waiting for it for a few months. So your vaccine common man तक कब पहुंचेगी? मेरा personal guess है that's probably summer of 2021. So I think it'll be efficacious, probably less than 75% efficacious, because these vaccines are not designed to be 95%. But here is the positive thing once again. If you do wearing a mask, maintaining whatever distance possible, wash your hand is probably as good as a vaccine. क्योंकि efficacy 50 to 75% तक होगी.
So masks could give you immunity before the vaccine. हाथ धोना और मास्क पहनना could give you immunity well before a vaccine reaches us.
I'm saying कि it is vaccine का purpose आपको protect करना ही है ना. यही purpose है. So ये 3 चीजें मैं आपको बार-बार बता रहा हूँ. ये मुफ्त हैं, ये आपके पास आज भी available हैं और आपको शायद उतना ही protect करेंगी. फर्क ये है कि आपको रोजाना करनी है. I get that. लेकिन it is a good bridge from here to the vaccine without losing your cool.
फहीम साहब, आप गालिब के ऑब्वियसली बहुत बड़े फैन हैं कि आपने कई बारी उनका जिक्र किया. इफ गालिब वर अलाइव टुडे, हाउ वुड ही डिस्क्राइब दीस टाइम्स दैट वी आर लिविंग इन? प्लीज लीव अस विद सम ऑफ हिज लाइंस.
ओह, देखिए, मैं तो नहीं डिस्क्राइब करूंगा, फिर तो मैं गालिब ही को कहूंगा कि वो डिस्क्राइब करें. कि लेकिन जब कभी मुझे ट्रोलिंग होती है व्हाट्सएप पे, और बहुत होती है, तो मुझे गालिब याद आता है कि हम कहाँ के दाना थे, किस हुनर में यकता थे, बेसबब हुआ गालिब दुश्मन आसमां अपना.
Bravo. Thank you, Faheem Younus. You have been very patient. You have spent an hour with us, 20 minutes extra than we were scheduled to spend. I know our viewers are very, very grateful. May you keep doing the hard work. A salute also right now to all our frontline workers everywhere in the world. Health workers, doctors, nurses, sanitation workers, ward staff. We will try and get you back as the science changes. Thank you for now. It's midnight. We're going to let you sleep. Morning here, midnight in America. Dr. Faheem Younus, the leading world expert with so much information. We've learned so much. Thank you very much. Goodbye and good night. Good night.
Wish you very best of luck. Bye-bye.
Thank you. And